Good evening, everybody. So tonight's topic, I wanted to talk a little bit about anxiety and a little bit with depression at the same time. So anxiety is a topic of vital importance. It's something that many people experience on a regular basis, as a matter of fact. Now, there's a difference between having a little bit of anxiety, such as people might experience on a day-to-day basis over ordinary things, and having a much greater level of what they call free-floating anxiety, which is where the anxiety comes to the point where it starts to interfere with how things are actually being it's starting to interfere with how things are being done. So in other words, the anxiety gets to the point where it interferes with your ability to speak, for example, or where it interferes with your ability to work on the job or get along with other folks and so forth. So generally speaking, the thing that determines whether something is problematic for a person happens to be just how problematic it is for an individual person. So how much is it interfering with your ability to do your job, take care of life, get along with your friends and family, and other things which are fairly subjective as well as objective. So just to get things out of the way in the very beginning of the presentation, if you or a loved one is suffering from anxiety or depression to the point of wanting to hurt yourself or others, please do not do it. Please call one of the national suicide hotlines, for example, 1-800-273-8255. And again, the national suicide hotline in America is 800-273-8255. Or please go to the emergency room that's closest or see a qualified mental health professional nearby you. So when it comes to anxiety and depression, this is one of the fields where we in family practice get a lot of experience because more people come to their family practice doctor than any other professional for treatment of their anxiety and depression. And so we end up seeing a wide variety of degrees between the usual little bit of blues or something versus the anxiety that becomes more interfering with the quality and the ability to lead a happy life. And so that's one of the reasons why, as a family practice doctor, we tend to prescribe more antidepressants and anti-anxiety medications than any other field. So psychiatrists may tend to see, in general, they tend to see a little bit more of the severe cases, although that's not entirely 100% true. So if you do suffer from anxiety or depression, do not feel afraid to go to see your mental health professional, because really that's their bread and butter. And as I said, it's also the bread and butter of your local family practice docs as well. So partly we end up seeing more people because there is a barrier to seeking mental health care in general. And whether it's because people are afraid of being labeled as something, or because they just don't know what to expect when talking to a counselor. Sometimes people think that talking to a counselor is going to be like some Freudian thing where you're lying back on the couch and somebody's going to analyze you and tell you all the ways in which your family done you wrong or something. In some cases that may be true, I suppose. But it doesn't necessarily have to be an in-depth exploration. Sometimes it can be focusing on behaviors or other things that can be done to help you feel better in the moment and as you progress moving forward. And so one of the things that I talk with folks a lot about is starting antidepressants, when to start antidepressants. Generally speaking, in my personal practice, and of course every doctor is going to be a little bit different in what they do, I tend to like the behavioral approaches and the nutrition approaches as a wonderful for-starter or component of any anxiety, depression management strategy. partly because it works. And also, when starting an antidepressant or an anti-anxiety style of medication, those things generally are a little bit slow to start. Usually it takes about 2 to 4 weeks, mostly on the 4-week side of it, at the right dose in order to see significant impact. Whereas if I have somebody go out and learn some relaxation techniques, touch up with friends, go exercise, eat healthier foods, those things have an impact almost immediately. I mean, for example, in one of Dr. Greger's presentations on Nutrition Facts, they point out that within minutes of eating a strawberry, minutes, you're getting those beneficial flavonoids and carotenoids and other the flavonoids from the strawberry are getting into your system and going up to your brain and basically causing you to get your feel-good stuff immediately, right off the bat. And so that's one of the other reasons why I tend to emphasize the lifestyle approaches much more in the treatment of anxiety, depression than just plain old medicine alone, because I want people to feel better immediately. And so every treatment strategy, every person is going to be a little bit different, and your anxiety is not going to be the same as the person next to you, for example, or somebody else in the family or others. Speaking of families, anxiety and depression, they tend to run in families, and there may be a few reasons for that. One, obviously, genetics, coming from the same pattern, but there's also other things that can cross family lines. For example, if there's something called intergenerational trauma, so that if you have a grandparent or great-grandparent that suffered through trauma, sometimes the maybe unconscious influences of that are actually transmitted between family members, parent to child, and it may have to do with different ways of approaching the world, different kind of unwritten rules that people just are not aware of, and so that's one of those things that can have a lasting impact for generations later sometimes. And other things about family patterns, well, usually people in the family tend to eat similarly, and so have other patterns, such as alcohol or smoking or other things that tend to also kind of go together. And for many of those reasons, anxiety, depression tends to run in families. If a family member, for example, has committed suicide, then unfortunately the other folks in the family are much more likely to consider that as a viable option as well. And so by taking good care of yourself and taking good care of your family members, you may be helping not just yourself, but other folks in the broader family and the broader community to take care of themselves as well. All right, so other risk factors for depression, anxiety. Well, we talked about family history and adequate social supports. So what do I mean by that? I've got 1,000 friends. What do you mean? Well, the difference between the types of friends we have in our social media and the types of friends that we have in a day-to-day human experience is that when people are looking at things such as social media, for example, hi Swami, for example, when they're looking at the Facebook, people tend to present not themselves when they've had a so-so day or when they've had a bad day, although sometimes that does happen, and they have a tendency to present the best of themselves on the social media. And so you end up scrolling through the news feed and seeing all these pictures of people on their vacation, people enjoying themselves, and part of you thinks, boy, I'm not on vacation. I'm not over in Germany today or Australia or wherever they happen to be. Or people will put up their pretty face, and generally speaking, it sets us up for social comparison without realizing it. So unconsciously, very commonly, people have a tendency to compare themselves to others, and if they see others doing well, sometimes they'll end up putting themselves down a little bit as well. And the other difference between the 100,000 friends on social media and a live human being is that when people are spending time, tweeting or typing to their friends and stuff on the social media, they're not actually interacting with each other. And for the children, you can see that a little bit more in terms of the tendency towards awkwardness or reluctance to talk to each other on cell phone or other methods or face-to-face. And you'll see kids texting to each other rather than engaging in conversation. So it does set up a little bit of a social anxiety as well. So, and of course, when you actually have other live human beings, then you can talk with each other, you can share, you can express, you can basically engage in being human. Humans are social creatures. We are okay sometimes to be on our own, and it can be very strengthening to be having some time to yourself for contemplation and taking care of yourself and other things. But at the heart of it, we are also very social creatures, and we like to interact and engage with other human beings. And when we don't do that, then we sometimes can feel isolated and very alone, and much, much more likely to be engaged in some of those negative thought patterns that lead to anxiety and depression and so forth. So living alone and having few friends or few social supports can definitely be a risk factor for anxiety as well. Stressful life events. This one's kind of a no-brainer. Life happens, and people we love pass away. People that we thought were going to be there forever, split apart. I mean, stressful life events, moving, divorcing, marrying, having a child, as joyful as that is, it's a major life change for many people. And those can put people at high risk for anxiety and depression as well. Having a child actually, because during the hormones of the pregnancy and then immediately after the baby is born, there's a huge topsy-turvy that happens in women's bodies, and this shift of hormones sets people up for the baby blues and postpartum depression, and occasionally sometimes psychosis as well. So if someone who's taking care of a baby and is getting no sleep and is starting to act funny at all, then please talk to them or have them go see their professional as well to take care of themselves. So medical illness. This one is an interesting one as well, because certain medical illnesses are associated more with depression or anxiety. So things that are associated with depression, well, there's some ones that you would think would be pretty obvious, such as having cancer. Heart disease is actually associated with depression as well, because believe it or not, when folks are having a heart attack or other heart disease, there's some interesting new studies about the hormones as well as the nervous system that connects to the heart that actually is linking that organ with the brain in many ways. So this is a new area of research on there. And so when folks are suffering from heart disease, cancer, neurological diseases, this one's another common one as well, where when somebody is having a stroke or has had a stroke, for example, then they're much more likely to have depression, anxiety, and so forth. When people have had post-traumatic brain issues, so in other words, they've had a blast go by, a car crash, they're a wrestler or a somebody who's gotten into a fight or otherwise have had several blows to the brain, they're actually much more likely to have depression, anxiety as well, compared to the folks who have not suffered these things. And so direct blows to the brain can cause anxiety, depression. And then hormonal diseases. This one is a very common one. Many times when folks are having a low thyroid issue, thyroid being down here in the base of the neck, and their thyroid just doesn't make enough thyroid hormone, well, they're much more likely to get depressed. Not on my list from Dr. Barnard, but other things, when people are anemic, they'll feel more tired and so forth. So there's definitely a lot of medical things that can contribute to it. So if you're having some depression or anxiety, or somebody that is, then there's some very easy tests to be done that can actually help out with this. In my professional experience as well, sometimes when folks have low vitamin D levels, because, we're humans that are not outdoors as much anymore. We're inside 12, 14 hours a day and getting less vitamin D or sunshine exposure than ever before. And that also can contribute to anxiety, depression, that sometimes can be reversible with adequate vitamin D. There are some specific diseases that are associated with anxiety, and the majority of the ones that I've got listed here actually have to do more with heart stuff. So when somebody is having a heart attack, they often report what they call basically a sensation of doom on there. They just get this feeling like something's wrong. And the irony is that when people are having an anxiety attack, they also have very similar things. And in both cases, people often focus right here in the center of their chest. In the case of, let's say, a simple anxiety panic attack, the cycle goes like this. Oh, I feel something here. And then they start to get that fear and they start to worry about it. And that attention from the mind on that physical symptom amplifies it and basically causes it so that that sensation increases and then it expands, and then basically it draws the person in even more, which causes the sensation to go even more. And now that they're hyper arousing themselves, their adrenal glands are starting to pump out the adrenaline, and everything just starts to tighten up in here. And so you can see how easy it is when people are having a panic attack. They think they're having a heart attack, and they don't just think it, they kind of feel it because their body is tightening up and responding in that way. So when people are having an actual heart attack, sometimes they get that similar kind of sense of doom and such. And that's something that I'll sometimes ask folks about when they're having chest pain and so forth. So heart diseases of various sorts, arrhythmias, in other words, feeling like the heart is going faster. Not only is feeling associated with anxiety as well, but also sometimes when we give people medications that slow the heart rate down, such as beta blockers, for example, propranolol, for example, is something I'll give folks when they're getting ready to get up and make a speech or something and they've got a lot of social anxiety. Well, there's a lot of studies that show that when the heart rate is just a little bit lower, then people's arousal, their autonomic nervous system, their anxiety in the moment is also a little bit lower as well. But sometimes when people are actually having irregular heartbeat, which you can check a pulse and see, is that beating regularly or not? If it's kind of doing a random beat, then you might also want to get that checked out, of course. But basically, heart irregularities can cause a feeling of anxiety. Congestive heart failure. Well, that one does it in both ways, both because it's the heart being impacted, and the heart, again, the hormones that are secreted by the heart can influence the mood. But also because that one does a double whammy, because it also impairs your ability to breathe sometimes, because sometimes the lungs have some fluid in there and they tend to not work as well. Asthma, again, another one that's associated with anxiety, both because of the inability to breathe properly, but guess what? The medications for the asthma increase anxiety. For example, the albuterol inhalers, those tend to be very stimulating to the system and worsen anxiety as well. So diabetes, low blood sugars, when people's blood sugars are crashing, again, it seems that anxiety, to some degree, serves a physiological purpose. It kind of alerts the brain like, hey, something's wrong. I better go fix something. I better go have a snack or something. And so when a diabetic is starting to have their crashing blood sugars, then basically their anxiety levels will go up. Cushing's and thyroid problems again. So when the thyroid levels are down, we get depressed. And when the thyroid levels are too high, we get a little more anxious than usual. Parkinson's, again, another brain disorder that triggers anxiety. And then, of course, cancer. So of all the drugs that are out there, there's actually a lot of common drugs that are in our environment that also tend to worsen anxiety as well. Caffeine is one of the first ones. I know sometimes when having a cup of coffee, you can feel that jitteriness going on for a few hours afterwards. By the way, if you are in need of elongating your caffeine experience, one little trick we learned in medical school was drink some grapefruit juice. It will inhibit your body's ability to break down that caffeine, and instead of staying in the system for only 24 hours, it might just stay in your system for a little bit longer as well. So, little random med school trick, but if you're having anxiety or heartburn, then ixnay on the coffee. Anyway, alcohol. This is another one that it's kind of a which one came first? Did the anxiety come first or did the alcohol come first? So people that are suffering from anxiety very often go to things that they can do to self-soothe. And because in our society we don't actually teach a lot of methods to the general population on how to soothe yourself, people may turn to social media, they may go to movies, they may go to the TV and kind of sit back and zone out and feel some degree of relaxation because they're switching their mind from their everyday events to something a little bit different. And in the case of alcohol, well, you do get some of that, but at the same time, it's a direct anti-anxiety effect in that very moment. People use it to inhibit their, or to get over their inhibitions for parties and social anxieties and so forth. But in the long haul, alcohol consumption actually can worsen anxiety. It has to do with basically those nerves that the alcohol attaches to and those receptors in the nerves. Well, after a while, those receptors really get dependent on the alcohol or dependent on something similar in order to function. And so it ends up worsening the anxiety over time. Marijuana, another medication that sometimes people will use nowadays, now that it's legalized in a lot of the country. Now, when people are using the marijuana, it actually can also be soothing in the moment, but in the long haul can actually worsen anxiety as well. A couple of the harder drugs, of course, cocaine and methamphetamines are pretty obvious as far as causing autonomic nervous system arousal and worsening anxiety. And then nicotine, of course, is another common one. So nicotine is another one that people often say, well, why do you smoke? Well, I smoke because I'm so anxious, and I see them shaking sometimes when they light their cigarettes. That's with the chain smokers, of course. And basically, on the surface level, they think that they're smoking the cigarette in order to lessen their anxiety, but what they're actually doing is their brains are pinging because they don't have that nicotine component in their brain anymore. They're basically trying to just soothe the nervous system with more of the cigarettes or more of the nicotine-containing components. So it's, again, usually getting away from the nicotine eventually will soothe that anxiety as well. Benzos, this is another one that's very common. Sometimes people will come up and say, hey, I don't have depression, I have anxiety, so why are you wanting to give me an antidepressant medication? And they want something that says anxiety on the label from the get-go. And you have to explain that although they do have their place in very short-term use, the benzodiazepine, so that's things like your Xanax and your Valium and clonazepam and all that, they can be helpful sometimes in a very short amount of time. So if somebody's going through a crisis mode, husband just left them, somebody just died, they need to get a little bit of relief or sleep, sometimes a benzo can be helpful in a short term. The trouble with the benzos is that when they wear off, we get rebound anxiety. So in other words, the anxiety it gets much, much greater after the fact. And so it leads to a cycle where people feel like they have to have that medication in order to feel less anxious, and then as soon as it starts to wear off, the anxiety really, really goes up, and so they take that medication again. So I've seen the unfortunate sides where people, instead of learning how to deal with whatever the life stressors are, somebody said, oh, you've got anxiety here, let me just give you a benzo, and then years and years and years later, you end up with somebody that's been on these medications for 30, 40 years and have become both psychologically dependent as well as physically dependent. So alcohol and benzos are very terrible drugs for anxiety, mostly because they set people up for a situation where they have to depend on the medication. But worse than depending on the medication is if the medication is stopped suddenly, then they end up sometimes going to a coma or basically getting seizures and potentially dying from not having those drugs on board anymore. Because when the nervous system gets so adapted to being stimulated by those drug medications, and then it suddenly is stopped, well, the nervous system can't quite handle it on there. So basically, part of the treatment for example, alcohol withdrawal is giving people some of those benzos in an IV line, because that way it's keeping those receptors occupied while the medication is slowly weaned down. So anyway, alcohol withdrawal syndrome is a kind of scary thing to treat. It's basically a 24-hour vigil in the intensive care unit along with the people. Hi, Ferfer. So basically, yeah, so those are a few of the things that are going around for anxiety and a little bit depression as well. So we covered a few of the medications that tend to cause anxiety as well. So very common ones like Sudafed, caffeine, and then stimulant medications. So sometimes when people are being treated for ADHD, I had a whole talk on ADHD already, it's not uncommon that folks that are taking these medications end up having higher anxiety in general. Steroids, there are a lot of people that are out there weightlifting and trying to take natural powders from GNC or other companies. I call them out because they're very popular around where I'm working. And the thing is that generally speaking, when you're taking in steroid style medications, it also can raise the anxiety levels. And the bronchodilators such as albuterol can trigger it as well. And believe it or not, some antidepressants can also trigger anxiety as well. So the medications are being able to treat it, but that's one of the reasons why we have people come back a few weeks later in order to look at it again, because with the antidepressants, it can both raise the anxiety as well as lower anxiety, and it's very individual dependent. So there are some other things that can contribute to anxiety and help relieve it as well. So talk a lot about foods in general throughout these videos, and there's a lot of great stuff on nutritionfacts.org as well as NutritionMD and some other resources. There was a study, for example, that put people on a high carbohydrate, low fat diet, and they saw within a couple of weeks people having some mood improvements. And when that was expanded over the course of a year, the changes held. And part of that might be because of the less lowered arachidonic acids in there. So arachidonic acid is something that basically is the end product that causes inflammation in the body. And so the idea is that when you're having inflammation, then the mind and brain tend to respond to that, and basically it causes a withdrawal response where people are kind of pulling away from the rest of the society and stuff. And so that happens when people are sick, but it also happens when your brain is a little bit inflamed. And so some of the reasons why the high carbohydrate and low fat and low protein diet, or low animal protein more specifically, tends to work too is not only are people reducing their arachidonic acid and other inflammatory components down to very low or almost zero in some cases, but also they're avoiding a lot of the contamination in the industry. There's a lot of different things that are given to and fed to or injected into the animal livestock in this country that end up causing people to have greater risks for anxiety and depression as well. And so I've also had that happen in my office. I mentioned in another presentation as well that One of the patients that I treated for pre-diabetes, so emphasizing much more whole foods and plant sources of calories and so forth, and withdrawing and reducing the amount of animal products in general. And she was just amazed at how much better she felt. And she's like, boy, I never realized I could be so happy. And, it's something you see all the time. And because of a number of factors, because you're not having that inflammation, because you're having a dietary pattern that reduces inflammation, and also those carotenoids. When you look at the package of, let's say, grapes, or I hate to use the example, but grape juice even, what you see is they're going to label it as having a certain amount of sugar, and a certain amount of protein, and a certain amount of other things, but left off the label are the thousands of little pigments and phytonutrients and other things that are in there that actually enhance the functioning of the brain and actually enhance the sense of well-being as well. And having a carbohydrate-rich meal in the evening has also been shown to help improve sleep, for example, and some of these components actually help the brain make serotonin. So why do we give people antidepressants and so forth? Well, one of the reasons, ostensibly, is so that it boosts the brain's production of some of those neurochemicals, such as serotonin and so forth. And so there's more than one way to skin a cat. So there's some great there's some great studies that show that exercise is about as equivalent as the antidepressants, and it works faster as well. So when people are kind of down in the dumps and anxious and depressed and stressed and all that, then sometimes the last thing they feel like they've got energy for or want to do is to get out and go exercise, get that heart rate going a little bit, and so forth. And so by encouraging activation, things like getting people out and moving, taking a walk, spending some time in nature and sunshine and so forth, as I talked about yesterday morning, basically those kinds of things, they can help immediately. Whereas again with the regular medication choices, those usually take a lot longer. Believe it or not, there's another series of studies being done on the gut bacteria. This is a really fascinating area of study as well, because the mind, the brain, the body, it's complicated. It's not just one simple, thing. A lot of things factor into how we feel. Are you getting good sleep? Are you getting enough sleep? Are you allowing yourself to get sleep? Watching these little devices like the iPads, iPhones, and Androids and such, those often emit very bright screens. They've got blue light that's involved, which basically causes your body to make less melatonin, and that can also interfere with sleep and sleep quality overnight. A lot of people are not getting enough dark green leafy vegetables or fruits at all, and so even if nothing else, paying attention to this presentation, please get some more dark green leafy vegetables like spinach and kale and arugula and all of those, because not only are those dark green leafy vegetables really good for your heart and your circulatory system, but they're incredibly good for the brain. There's been some studies on Chinese diet, for example, that tends to be very rich in folate and B vitamins. And I'm talking about the more traditional Chinese diet, not what we find in our Americanized restaurants, which tend to be pretty high fat and stuff as well. But anyway, those tend to be very rich in the B vitamins. Yes, Farhan is writing, how about carrots? And yes, those are also carotenoids. If you look at nutritionfacts.org, there's a lovely presentation on there about the antioxidant content of food and basically how it improves people's mood and such. So the brighter the pigment, the more likely it is, especially if it's natural, a pigment not like the petroleum-based ones, that tends to help improve mood as well. Omega-3 fatty acids, that's another one that's a lovely one to incorporate. Flax seeds are my favorite for that. And those are best if they're ground up right away because it keeps the lignans and the other things so close at hand. There's some interesting studies on green tea, basically how when people were drinking the green tea, and they got these little electrodes put on them to watch the brainwave patterns. The folks that had the green tea actually had a more Zen-like state that they could see on the presentation as well. And so certain flavonoids and certain micronutrients that are present in the foods can also have a tendency to calm and soothe the mind as well. Passion flower, chamomile, and lemon balm tend to be among the things that have been shown to be calming. Occasionally, I've had some success with folks with mild anxiety that have their water bottle with them all day, and I'll just suggest throwing a chamomile tea bag in there and just let it sit. It does not have to be hot water by any chance, or a green tea bag, or any of the many varieties of preparations that are out there, because sometimes these simple things can make a difference in how people feel and their moods and everything. So I think I'm going to wrap up this presentation for the moment. I've got a few other things I'd like to talk about with regards to anxieties and fear, which are less of the medical side and a little bit more of the philosophical side. And so I'm going to do another presentation at some point in the future on this as well, just to have a broad breadth of presentations on there. And as always, if you or a loved one is suffering from depression or anxiety, and if you feel to the point that you want to hurt yourself or others, again, as mentioned in the very beginning of the video, under the same sentiment, please do not do it. Please go to the nearest emergency room, come see your family practice doctor, and of course, you can always call one of those hotlines, just the number again. The National Suicide Prevention Lifeline is 1-800-273-8255. Again, that's 800-273-8255. Or, because I never know what is going to happen in the course of these presentations, if you're having any trouble, please go ahead and call, go to the emergency room, seek help, seek a lifeline, as it were. And thank you for spending some time with us tonight. And we'll have a little bit more in a little bit, and we'll talk to you guys again. Have a good night. Thank you for watching.